Here to present to you peer review and NP performance evaluation process of United Healthcare. Well, I'm going to start with what is really peer review and some folks. This really simply means to evaluate a colleague's work, whether formal or informal. Peer review were experienced by all walks of life. Even the kids have done it in school. Let's watch the kids' way of reviewing their peers.
Size for students of all grades. However, some people don't know how to do a quality peer review. You have two ands in your paper. That's too many ands. You call that a period? There's a little line at the bottom. It looks like a comma. Ooh, half a centimeter of your title is not underlined. Oh my gosh, you put such a big space between that word and that comma. If you don't care about the process, it ruins everything.
You spelled cat wrong. It's C-A-T, not K-A-T.
Yeah, sure.
I would rate your topic sentence a 3.
Yeah, whatever.
I would grade your paper D+.
Cool.
Some peer reviewers give suggestions that do no good because they aren't specific enough.
You spelled some words wrong, plus I think you're missing a few capitals.
Where are they?
On the paper.
Where on the paper?
Kind of everywhere. All over the paper.
Have you ever worked with someone who insists on you taking her advice?
Fox is spelled F-O-A-X, not F-O-X.
Why don't we go get a dictionary?
Just change it. Do you, not trust me?
I think it's spelled F-O-X.
Just change it.
Well, it is my paper.
Listen, that's the way my mom spells it, so if you don't change it, you're going to be insulting me and my mom.
So is that what you wanted to do and hear with APN review? I don't think so. Based on that video, it seems that there are similarities with APN review process. One of which is that the kids are of similar grade level. American Nurses Association (ANA) proposes that nurses with similar rank and clinical expertise should conduct those peer review evaluations. So what's the definition of peer review for nurses then? The literature frequently refers to the ANA's definition as cited in its 1988 publication, Peer Review Guidelines. This definition is the process by which professionals from common practice areas systematically assess, monitor, make judgments, and provide feedback to peers by comparing actual practice to established standards. In United Healthcare, I actually incorporated the NP performance evaluation process too because they kind of like considered going hand in hand. And their model that they use is novice to expert model. This model has a clinical context of about 5 levels from novice to expert. And actually, I'm thinking of like changing the name of my little girl now to Patricia because it seems that this name is associated with brilliance. This model has been introduced by Dr. Patricia Benner, and she believes that expert nurses develop skills and understanding of patient care over time through a sound educational base, as well as a multitude of experiences. And there's Dr. Patricia Benner. I wanted to dig deep into the United Healthcare process and timelines. United Healthcare NPs visits the Medicare Advantage program patients and members monthly. They also do a chart audit monthly, looking on the cost-effective utilization of benefits and services, completeness of documentation, adherence to the business model, and they have also the one-on-one monthly with the clinical manager, which is also an NPN profession. They also have this MD and facility feedback gathering that is done by the CMs as part of the NP performance evaluation process. So what is this NP performance evaluation then? What are they looking, and let's go dig deep into that. They're looking at the financials. Money matters. They monitor utilization of metrics and documentation accuracy with the development and implementation of interventions to ensure targets are achieved. They're also looking on the Arizona long-term care customer-provider relations to make sure that the collaboration and partnership with internal and external providers are maintained and established. They're also looking on the Arizona long-term care fundamental execution of clinical model. Execution and oversight of clinical model, service delivery including quality initiatives with necessary documentation including frequency and content as measured by a specific scorecard. Another one they're looking at is the vital assets, which is the people, the NPs themselves. NPs should maintain professional licensure certification to ensure clinical proficiencies are up to date for the delivery of optimal care. NPs also should participate and support activities which promote the professional image of the organization, including volunteer and recruitment activities. So, my conclusion is that United Healthcare in Phoenix does not have peer-to-peer review with their APNs. There is an MD and facility feedback gathering that was embedded in the NP performance evaluation and monthly one-on-one with the clinical managers, in which folks mistakenly look at this as a peer review, but based on the ANA definition, it is actually not. Again, ANA proposes that nurses with similar rank and clinical expertise should conduct these evaluations. Some local jurisdictions may also mandate that advanced practice nurses review one another's care, not the MDs and not the facilities. So these are my recommendations. First is to implement a monthly or a quarterly peer review. The hallmark of a true profession is the ability to self-regulate. Implicit in self-regulation is the evaluation of individuals' actions as compared with the group as a whole, or a set of criteria determined by the profession to satisfy a specific level of practice. Peer review is a mechanism by which APNs can demonstrate self-evaluation and self-regulation. The process should be created through identification of affected APNs and soliciting their input. Another one is to determine the purpose of the review, select appropriate standards and identify the sources, and to develop a tool of the forms and make sure that APNs are being educated on the forms and the tools that they're going to be using. Another recommendation is to discuss the peer review tool or the form. APN should become familiar with sources of evaluation criteria and tool formats for this peer review. The advantages and limitations of various formats and processes of peer review should also be considered. Another recommendation is to incorporate PI or practice improvement. They could do that by implementing PI projects through the AANP model called PDSA, Plan, Do, Study, Act. Examples of PI projects include: number one, increasing the percentage of patients with DM for home A1C documented twice a year by 20% within a year. Another example is to increase percentage of patients with chronic cough with documented screening spirometry by 30% within 3 months. And my last recommendation is to incorporate motivational interviewing skill review. And I anticipated that this will only be included to those NPs who undergone motivational interviewing skills training. What is this all about? Motivational interview is defined as a client-centered, direct method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. Motivational interviewing focuses more on exploring and resolving ambivalence and centers on motivational processes within the individual that facilitate change. NPs and some other providers usually just give the prescriptions and let the patients or the members do the rest. We don't, and we really don't have any control after the patient or the members leave the office. It is up to them if they will give the medications to their kids, or they take the medications themselves, or if they refill the prescriptions in the pharmacy. Now, the skillful MI practitioner is attuned to client ambivalence and readiness for change, and thoughtfully utilizes techniques and strategies that are responsive to the client. The review should focus on 3 elements. Number 1 is the conversation about change during, like counseling, therapy, or consultation. Another thing that they need to look at is to how the provider collaborate with the patient. And number 3 is the evocative part, which seeks to call forth the person's own motivation and commitment. And that ends my presentation, and these are my references.